Nurse Paige, and today we're going to be covering how we would inform our patient if they were to have a fluid volume deficit. This condition essentially means that the fluid output is exceeding the fluid intake, so you're not getting as much fluids inside of you as you are excreting them. So if you were to explain this to your patient, they would first want to know what their condition was. So you would just let them know that you need to get more fluids in their body because their body is lacking the amount of fluids that it needs to be sustainable. So some signs and symptoms that you may run across in your patients if they do have a fluid volume deficit would be, it could be vomiting, diarrhea, dry mucous membranes, high blood pressure, high heart rate. So those are some things when you're taking their vitals. You want to, if they have a heart rate that's over normal, or if they have blood pressure that's higher than normal, then that could be a cause. Muscle weakness and weight loss and confusion. So if they seem kind of dizzy or like their level of consciousness isn't intact, then they may be dehydrated. A lot of times people will say dehydration for fluid volume deficit, but they are not synonymous. They can't be used interchangeably because dehydration means a total loss of body fluid, where fluid volume deficit just means that you have lower than normal fluid in your body. So next we're going to be covering the types of fluid volume deficit. There's three types. They're isotonic, hypotonic, and hypertonic. Isotonic just means that the salt and water in your body are equal. So iso is another word for equal, and tonic is a word for concentration. So basically your salt to water concentration are equal on the inside of your cell. So the extrastitial and intracellular and extracellular layer. So you have your inside of your cells, the intracellular, and outside of it's the extracellular, and that's where all the salt and water ions are located, and they pretty much go in and outside of the permeable membrane through osmosis. For this type of FVD, you would use fluids. Some of these fluids would be 0.9 saline, 5% dextrose in water, also referred to as DSW, and 5% dextrose and 0.225% saline. So you would use different fluid types for each type of FVD. For this one, it's more of like a lower percentages than it would be for say hypertonic. You'd use higher percentages of solutions. You're doing this in isotonic. The reason why you're using these solutions is because you're replacing the extracellular fluid that has been lost. So, another fluid would be the lactated ringers, or LR. So essentially you're just replacing the extracellular fluid that's been lost. You need isotonic solutions, say if you have blood loss, dehydration, or surgery. Those could be some causes of why you might want to use this. For hypotonic, your salt is less than your water. So you have less salt than you would water. So what happens is H2O flows into the cell, and it can cause the cell to swell, and it can potentially rupture, and that's called cytolysis or lysis. So whenever this cell swells, it can deplete the circulatory fluid. So you don't have enough blood circulating through your body if this happens. Some fluid types that you might use for this condition would be 0.45% saline, 0.225% saline, or 0.33% saline. These help hydrate the cells, and we would use these if we had a diabetic ketoacidosis patient or a hyperglycemic patient. That would be some instances where you would want to use this. The third one, hypertonic, is when you have more salt than water, so it's very concentrated. The cell shrinks and kind of shrivels up, and this is called plasmolysis. Fluid types you could use for this would be 3% saline, 5% saline, 10% dextrose in water, 5% dextrose in 0.9% saline, 5% dextrose in 0.45% saline, or 5% dextrose in lactated ringer. So there's a lot more solutions for the hypertonic condition. These are all a lot higher, and you have to be careful because a lot of times this can be hard on their veins. It's usually in the ICU that they use this for more chronic patients. So with these fluids, you also have to be careful because it can cause fluid overload. And if you get fluid overload, it can cause like pulmonary, where you essentially get water in your lungs. I forgot what that's called, and then it can cause cerebral edema or hyponatremia, which means hyponatremia just means like you don't have enough salt. And then cerebral edema is just like swelling of the brain cavity. And then for my assessment on my patient, what I would do is I would check their pulse. The pulse would be weak and thready if they had a fluid volume deficit. Then I would check their jugular venous distension, or JVD. These veins in the neck are right here, and they would be flattened if there was dehydration. Then I would also auscultate their lung sounds, and I would listen for crackles. That could be a sign of fluid overload if you hear any crackling. For fluid deficit, it could be stridor or wheezing sounds. I would also check the vitals just to check for the blood pressure, heart rate, and all of those things. I would assess the skin turgor and mucous membranes. Skin turgor is just another word for the elasticity in your skin, like how fast it goes back to normal whenever you pinch it. If the skin stays pinched and doesn't snap back immediately, it could be dehydrated. And mucous membranes, if their eyes and their mouth seem pretty dry, then that typically means that they're lacking fluid. And then you assess the color and amount of urine. So for fluid volume deficit, their urine would be dark and concentrated, and they wouldn't have enough urine coming out. So for instance, you would want to report if they have less than 30 milliliters an hour for 2 consecutive hours, then that would mean that something's bad wrong. And some nursing interventions that I would take with my patient would be, I would want to weigh them daily to make sure their weight isn't fluctuating at a high rate. I would help ambulate them wherever they need to go, because if they sit up too fast, or when they sit up they might get dizzy when rising, because their blood pressure is high, and when they're dehydrated they can get dizzy easily. I would assess their labs to check for their normal levels and see if they're staying the same or getting worse or getting better. I would make sure that they had a good diet. I would have them eat like not too much sodium, because if they eat high levels of sodium, then that can cause them to become more dehydrated. And I'd have them drink enough fluids. I would also do an IV infusion or oral. Oral is the preferred way, but you can do IV. Excuse me. You can do IV if they're throwing up or vomiting or have diarrhea. Then you want to do oral you want to do IV because they can't take anything orally. It'll just come back up. And then also, when you do their vital signs, you want to do orthostatic, which is when you want to take their blood pressure when they're supine, lying down, and standing up. This will check to see like how their blood pressure is doing. And then fluid volume replacement, of course, you want to replace that fluid. So you want to use that, you want to do that through an IV. Some complications that may occur with your patient if they have FVD would be fluid overload. So if they have hypertonic solutions going through their IV, then they could easily get fluid overload. And if that happens, it could cause pulmonary edema, which isn't good because then they won't be able to breathe and they'll start to have dyspnea. And then another complication could be congestive heart failure, delayed wound healing, impaired bowel function, metabolic acidosis, which means too much acid accumulates in the body, hypovolemic shock, which just means the liquid portion of the blood is too low. And then for the worst complications, potentially if they're too dehydrated, they could go into a coma or die. For your labs and radiology diagnostics, whenever you get your lab reports back, what you want to pay attention to is their hematocrit levels. So if their levels are higher than normal and they're increasing, then that means that they could have a fluid volume deficit. This just means when their hematocrit levels are high, it means their RBCs per volume of fluid are really high. So that's what that means. Sodium levels, if they're high, that could mean that as well. That's called hypernatremia. BUN, if their BUN increases, that could be a sign of fluid volume loss or deficit. Their serum osmolality, that should increase as well if you have a patient with FVD. Their urine specific gravity also increases and gets higher because it's more concentrated because they don't have any fluid to dilute their urine. Blood pressure increases and heart rate increases because they have less fluid to pump their blood through their body, so they're having a harder time, so their heart's having to work harder. Risk factors that could cause fluid volume deficit could be working outdoors or like exercising in the heat. This is because they're losing a lot of water through perspiration and they're not drinking enough to put back into their body. Lack of resources, so for instance, if you have a homeless patient or someone who doesn't have access to food and water, that could be a problem because they're not able to intake as much as they're outputting. And then age could be another risk factor, such as infants and the elderly. They're known to get dehydrated easier, so that's another risk factor. And then whenever you're explaining to your patient how to prevent or maintain their fluid in their body, prevent fluid volume deficit or maintain fluid in their body, you want to make sure your patient is able to describe symptoms that indicate the need to consult with a healthcare provider. So you want your patient to know what they're feeling like and what it means so that they can know when they're in danger and when they need to go get help from somebody who's a healthcare specialist. Patient can verbalize awareness of causative factors and behaviors essential to correct fluid volume deficit. They want to live a lifestyle that's going to promote their healthy well-being and not get dehydrated by not eating the right things or drinking enough fluids or participating in activities that could cause them to become dehydrated. They want to drink plenty of water and eat lots of fruits and vegetables in their diet, and you want to avoid a high sodium diet as well. And then they want to avoid drinking too much caffeinated beverages and alcohol because this can also cause them to become dehydrated. And I believe that's it.